what are the different types of research flavors we have, um, ranging from case reports to case series to the cohort-based studies like retrospective and prospective studies, or going to the next level, the clinical trials. And even in clinical trials, we have a open label, randomized label. We have different versions of clinical trials. So today I'll give you basics of all these, and especially the PICO-based research approach. We'll go through that, and I will go with the explanation. So some of the content might not be in the slides, but I will go through the examples so that you fully understand. Everybody can hear me well and can see my screen.
Yeah, we can.
Okay, good. So research methodology. So in research, this is a famous research pyramid. Uh, Now, the bottom of the pyramid, you have research editorials, which are very short summary story on any new topic, or a news page, which are very, very short. Like, let's suppose um, recently Jack, the Journal of American College of Cardiology, invited me to write an editorial for them. Um, so basically, they want me to write an editorial on drug-coated balloon stents in the peripheral artery disease. So like the editorial was about like what are the factors that can increase the stent thrombosis, the closure of the stent after they get a stent in the peripheral artery. Now, a lot of the content we know about the coronary artery disease, but peripheral artery disease still a lot of the research work is pending. So basically, now this particular focus topic, I have to write like 400 to 500 words, and that is an editorial. Okay. Now, in the short section, also here you're gonna have letter to editors. Okay. Now, I think I did like a one letter to editor. Um, so again, I will go through the examples so that you guys understand. Um, so I think I wrote one letter to editor. I can show you any example. One second. So this is something called letter to editor. Let's suppose you conducted a research study, and here we're gonna see an example. Probably this is the main article, so we're gonna open that. And again, if you want to open any free article, or whenever you go to the PubMed, you open the article. If you see free full text, okay, this is a free article. So this journal is open access and free. But what if you don't? Then this is a website, Sci-Hub. I would like to introduce this website to you. It breaks all the scientific barriers, and you can open any article for free on this website. So I think this website is um, worth mentioning here. So, so letter to editor or correspondence is 400 to 500 words. Let's suppose I did a study, and here I would like to show you one of my studies. So, so let's suppose you did a study. Here my topic is primary Takotsubo, people who have stress cardiomyopathy, and people who develop stress cardiomyopathy due to secondary factor. Okay, now the primary factor can be just psychological or just like without any secondary factor, while the secondary factors can be due to sepsis, due to pneumonia, due to any other secondary cause. Now, Whenever we do research study, we should have a intervention group and a control group. Okay. Now, some of the terms might be new to you. What do I mean by interventional group and a control group? In order to understand this concept, I know it's a tricky concept, you will have to understand PICO questionnaires. So all the research models are based on these questionnaires. Okay, let's suppose your question is clopidogrel better than aspirin or clopidogrel after drug-eluting stents in coronary artery disease? Okay, now this simple question. Now what's my P? P is my patient population. P is patient population. So in my research question, what's my patient population? People who had coronary artery disease. Okay. Now you can ask yourself, coronary artery disease is a vague term. Am I taking patients with STEMI or unstable angina? So you need to define that. Okay, I'm gonna take people with unstable angina, STEMI, and NSTEMI. Just acute coronary syndrome. Okay, acute coronary syndrome. I for intervention. Here, what I'm trying to study in my research question. I'm trying to study is clopidogrel, which is a brand name Plavix in the US, is it better than just using uh, is it better than using aspirin and clopidogrel? Okay, so my intervention is just Plavix or clopidogrel. My control arm is what is aspirin and clopidogrel. So that's what I'm looking for, what I'm comparing between these two. I know my intervention arm, what I want to study, my control arm, what I want to compare it with. Whenever anything new in the market comes through the research, you need to have a gold standard or comparison. You can't just say, okay, I found out this stuff and don't have an um, comparison to it. You need to have a gold standard comparison. Like for example, when Apple Watches came in the market, you can't just say that Apple Watch um, showing like a 1 lead EKG is way better than 12 lead EKG. You can't just say that. You have to have a comparison, and 12 lead EKG is your gold standard comparison. Anyways, so O for outcomes. Now, outcomes you can divide into the primary versus secondary outcomes. Okay, my primary outcome, I can divide my primary outcome into cardiac mortality, and secondary outcome I can see. Let's suppose I'm looking for AKI due to these medications, or bleeding due to these medications, or stent thrombosis due to these medications, or all cause mortality, whatever I'm studying. So this is the that's how you organize your research question. Okay. Coming back to the types of research. So bottom of the pyramid, you have editorials, you have letter to editors slash correspondent. Now, I did this study and I showed the result that clopidogrel is better than aspirin and clopidogrel in terms of cardiac mortality. Okay. Now, someone can make a comment and write an editorial on that and say that all the patients included in my study were middle age of 45 to 55. So, or maybe all the patients in my study were like 89 and they had high mortality to begin with. And it's not actually the clopidogrel improving mortality, or the other group having like a worse mortality, something like that. So if someone is asking question on the paper which I already published, I have to respond to that in the letter to editor. Okay, so it's just like the communication after you publish something. All right. So wish I can show you. We had we had done one letter to editor, so I think it's really important. Okay, here. So this I was reading up a paper in International Journal of Cardiology in Heart and Vasculature. This is the original paper. So I want you to read this paper and then read over. So this paper states that, look at the conclusion. In conclusion, 30-day adverse events rate were low in those with the stable low level, high sensitivity troponin elevation who ruled out MI and were discharged. So they, in this study, bottom line, they took people who had a chest pain and mildly elevated high sensitivity troponin, and then they actually talked about people who have coronary heart disease. So when I read this paper, I found a couple of deficiencies, and then I asked them a clinical question in the form of letter to editor. So while with the interest, we reviewed this paper about this. So first you're gonna write down their title, and then authors reported this. A shortcoming of this study is um, that author is saying that the high sensitivity troponin level below 50, this statement implies a type 2 MI or demand ischemia. Given the vast majority, their patients did not receive a coronary angiography, um, and also a demand ischemia term in the cardiology is, it's a very vague term. Anything, any medical condition can cause troponin elevation in your blood to begin with. So, and also sometimes medications such as um, um, aldosterone receptor blockers or Entresto, which is the medication that can affect your troponin levels also. But anyways, bottom line here, I'm trying to explain that any article you can have, you can make a clinical question and publish it as a letter to editor, and then whoever published that article have to respond to that letter to editor. Okay. Now next comes the case reports. You're pretty much familiar with these. I mean, seen a lot of people publishing case reports. So, so case reports, basically, so for example, this one. Let me just show you this one. So case reports. Sorry, give me 1 second. Okay. So I will try to um, update you about the case reports. Basically, in the case reports, you have introduction, which is very short introduction, like 200 words or 300 words. Um, and then you have the case. How does a case presented, right? What you did to diagnose that case, how you treated that case, and then what is the these are all diagnostic criteria, and how your case is unique as compared to case which was published in the past. So case reports are pretty easy to publish, and they highlight the importance of the case, and they also add on a clinical um, clinical stuff like that will be helpful for the physicians, and then you end up with the conclusion. So, worth looking parts here for the case reports are conclusion, you have discussion, you have case presentation, and always make sure you have the images or videos or tables in your case, and then you have introduction. Okay, and you're gonna have very summarized abstracts, 200 to 250 words. Okay, so we talked about the case reports. Next, we're going to talk about case series. Um, I will also explain things in Urdu also. So, case series basically have like three cases. Now you're going to present what's the uniqueness of these three cases. Okay. So, give me 1 second. I want to show you one case. Okay, this was my case series. Now, worth noticing here in terms of the legalities of the research, if you have a three cases, it's fine. You don't need a IRB, which is Institutional Review Board Committee document that you're legally obligated to get if you have more than three patients and you're conducting a research study. Okay, so here I took only three cases of COVID with colonic manifestation. So here I'm writing case number one. How does that case presented? Then I'm writing case number two, why how that one was presented, in case number three. And then I'm having like a very short discussion. Now some journals don't need the headings, but the pattern of the writing is the same. Okay. So and then I have very short like conclusion. So the pattern here is the same as that of the case report. It's just that this journal do not like headings on the top. So this was introduction. Then I have case presentations.